Fake news about the coronavirus has become a serious problem on social media. Some conspiracy theorists have even linked 5G technology to the outbreak of COVID-19. To bust these myths and talk about other matters, I'm joined by Professor Salim Abdool Karim, Chairperson of the Health Department's Ministerial Advisory Committee. Professor, as always, thanks for taking the time to speak to us. We know you're a very busy man, so we appreciate it. We're seeing so much mis- and disinformation having an alarming impact on vaccine hesitancy. So let's go ahead and bust some myths. Is there any truth to theories about vaccines containing microchips or genetically altering material?
Good evening, Anlie, and good evening to all of the viewers. So let's put it straight and let's deal with the facts. So all of the vaccines that are being manufactured, they contain elements that enable us to recognize the virus. They have no microchips at all. None have microchips. And none of them contain elements that are intended to denature your RNA or your DNA. That's simply not true.
Great, so that's a good start. What about claims that COVID-19 is caused by 5G towers? That's something we've heard again very recently by an ANC councillor in KZN. Please bust that emphatically for us.
So this was a big issue when we were dealing with the coronavirus pandemic back in about May, June last year. It went viral in the US because people were arguing that these 5G cell phone towers were the new things that were being built, and that's what was causing this virus. And of course, it's stoked by individuals who thrive by promoting these kinds of conspiracy theories. There is no link whatsoever between anything your cell phone does or any of the waves that it uses and this coronavirus pandemic. This pandemic is due to a real virus, one that we can see under the electron microscope, one that we know how it causes disease. And 5G, 4G, or any G has no impact.
People who are fearful of the side effects or possible long-term damage from vaccines often form this opinion from hearsay, out of fear, but they very rarely do enough research themselves to form an educated opinion. So where should they be going to access trusted, balanced, accurate information on both the benefits of vaccines and possibly, if they exist, some of the dangers?
So there are generally three groups of individuals who are hesitant about taking vaccines. The first group just don't know enough about it. They're not sure if they really want to take a vaccine or not. They don't really understand how it works, and they might have heard something negative, and so they're just hesitant because of their limited knowledge. The second is a group that is concerned because they've been misinformed. They've been generally told something or read something that really does not convey the information accurately. So they are misinformed, not uninformed, misinformed. Then there are those who are deliberately anti-vaccine. And they are the ones who often end up spreading the misinformation. And it's that group, which is quite small, that uses social media and other platforms to promote their message. I'm a strong believer that any person who does not want to take a vaccine should not be forced to do so. I think that people should be able to make up their own minds. And if they're not sure and they feel they need more information, it's our job, all of us. It's your job, my job, media, the public, the community organizations, all of us, government, private sector. It's our responsibility to ensure we promote and provide the most accurate and up-to-date information on vaccines so that people can make an informed decision.
Some would say that government has been sort of missing out of that picture so far, and we understand that government and all of its relevant structures and organizations have been very focused on trying to secure doses of the vaccine. That's absolutely and should be the priority. However, some form of information campaign, and it needs to be highly curated, and specific information in that campaign has to be put out on a large scale to bring South Africans up to speed. When are we going to see that rollout?
I have no idea. We'll have to establish from the communications people when that's going to happen. I can say that from a scientific point of view, that information is now going out into all of the platforms that we see. It doesn't matter whether you read Medscape or any of these medical educational platforms. They are providing quite a lot of valuable and useful educational material for providers, for people like myself, nurses, individuals in pharmacies and so on, because that's an important group to target as well. And it's our professional associations that must also play that role. With regard to the public, our role as professionals is to diffuse that down. This is not, people are just not going to change their mind because they read some billboard or they saw some advert. That's going to be important and plays a role. But it's also every one of us who understands and knows vaccines has to talk to others. We are all agents of change, and we can play that role constructively if we know people who are hesitant, need people who are uninformed, help them out. That's how I see an educational program to address this challenge, not merely a marketing program, but one that deals with it at its roots.
Another point that seems to be taking a lot of attention away from the vaccine is the use of ivermectin to treat COVID-19 infections. What's your expert opinion?
So it's just, there's a playbook that I can describe in terms of what happens in this epidemic, because I've now lived through almost 10 months of it, trying to understand it in a lot of detail. But one of the things that happens when the cases start going up, when people begin to see family members, friends getting infected, dying, and they get the sense of frustration, they get a sense of helplessness, they get a sense of, what's going on here? I need a miracle cure. And I saw in the first wave how desperate people were for a miracle cure. Within days, they wiped out and bought every bit of hydroxychloroquine in every pharmacy. There were calls. I was getting letters from people wanting to know, why aren't we make artemisinin, which is a miracle cure from Madagascar? Why aren't we providing it to the people? Why are we depriving them? So the first wave, we had artemisinin, we had hydroxychloroquine. The second wave, we get our new drugs, ivermectin and so on. People who are clutching at straws, where the evidence is flimsy, but often there's some person with some kind of agenda promoting it. And that kind of promotion based on inadequate information, and often it involves professionals who should know better. In my view, the evidence is unequivocally does not support the use of ivermectin at this time. There are several trials underway. Some of them look well conducted, so we'll wait to get those results. Until then, ivermectin that's available in this country is for animal use only. It would be professional misconduct, in my view, if a physician or a doctor had to prescribe an animal medication for humans. And it would be professional misconduct if a pharmacist dispenses such a drug to a human.
Prof, before I let you go, I know my producers are telling me we've run out of time, but I have to ask you this question. In a radio interview yesterday, you said, and it was quite an emotional, heartfelt moment, you said you feel like you'd let the country down in terms of pursuing a vaccine strategy sooner. What did you mean by that?
So perhaps I was a bit stronger than I should have been. The point I was making is that in June, there was an opportunity where colleagues of mine were talking about, and they were talking about it openly, wrote articles about it, and all of us knew that they were talking about why don't we use our country's capacity where we can make chicken coronavirus vaccines? Why don't we use that capacity to make a human coronavirus vaccine. And I was supportive of the idea, but I just never had the time or energy to really see that forward, because we would not have a vaccine from that initiative now. It would take years to build a facility and to do that. But what is really important, and the opportunity I felt I missed, was to initiate a process that would build the capacity for our country to make vaccines, not for this pandemic, but for the next one. And that, I feel, was an opportunity lost. And I hope it's an opportunity we may be able to regain as we deal with this pandemic and as we look to manufacturing and making a local coronavirus vaccine.
As always, thank you so much for your time, for your insights and for your expertise. Professor Salim Abdool Karim, he's the chairperson of the Health Department's Ministerial Advisory Committee. Very important, busting some coronavirus or COVID-19 myths.